Josie, you ready? Yeah, good afternoon. Pleased to say that today our successful efforts against COVID continue with now another 2 million Washingtonians today eligible for this life-saving vaccine. That means in Washington state that there are fully 5 million people in Washington that today have access to this life-saving vaccine. And this means that 5 out of every 6 Washingtonians now have access to this vaccine. And it simply means that if we continue to be diligent, if we continue our vaccination efforts, we have such a great opportunity to defeat this virus in Washington state. A little more than 1 million Washingtonians over the age of 16, of course, will still be waiting for their eligibility. And today I'm very pleased to tell you that their wait will be shortened. Starting April 15th, 2 weeks from today, and just 4 months since we started our vaccination program, all Washingtonians over 16 will be eligible. So beginning on April 15th, all remaining Washingtonians over the age 16 will be eligible. We have 4 out of 5 million eligible today. It'll be great to finish that remaining 1 million folks in our state. We are confident we can take this step because of our dosage allocations have increased. We've now had roughly 3.3 million doses that have been administered in our state. And more than 1 million Washingtonians are already fully vaccinated, so that's great news. Basically, what we have to say is our efforts are working in the state of Washington. They've been working because we have made decisions based on science. They've been working because we have made priority decisions that have respected people's lives and our fundamental goal, which is to save lives in the state of Washington. And we are saving lives in the state of Washington big time. I'll just share with you a graphic that shows our per capita fatality rates in the United States relative to other states. Obviously, we wish they were 0. But you'll see Washington down to the right in one of the top 7 states, I believe, and keeping fatalities down. This is significant because it means we have saved thousands of lives. In fact, if we had had the same fatality rate as the state farthest to the left on this graph, we would have had an additional over 15,000 Washingtonians lose their lives. And if we had just been at the average level of losses in the United States, we will have lost an additional over 7,000 people in our state. So I think it's testament to the decision-making that we have all made in Washington state, both about the vaccine distribution program and about our efforts to wear masks and avoid unnecessary social occasions where we cannot be distanced. It is heartening that we have saved, tens of thousands of lives in the state of Washington. But we are not done yet. We need to continue our efforts and to speed going through our prioritization with this vaccine. And we need to do everything possible to keep the number of these cases down. Now, in that regard, I just want to talk about the continuing challenges we have. We are seeing a disturbing uptick of cases in the state of Washington. And we know this for certainty. If we want to avoid a rollback of some of the progress we've made in our business reopening and the like, we need to do everything we can to keep these numbers down now. Obviously, the vaccine is a critical part of this because the new evidence is that it is very encouraging that it can keep not only lives being saved, but to reduce the transmission of this virus. But it's also important that we do our part in addition to the vaccine. Social distancing, basic hygiene, avoiding unnecessary indoor gatherings, particularly when we're not masked, and wearing this mask anytime we can to continue to keep these transmission rates down. Obviously, we still don't have a supply to make this available to everyone today, so we all, or many of us, are going to have continued patience, but I'm so happy about the rate of the vaccination we now are obtaining in the state of Washington. And eventually we know that everybody's going to have access to get this vaccine. There's good news on the front regarding children as well. You may have heard today reports of of efficacy involving, I believe, 12 to 16-year-olds. So there's good news of our younger folks as well. So this is great news. It's great news that we know what we're doing is working. It's great news we know we can restrain this virus, and I want to appreciate people's efforts in this regard. Now, I'm aware some other states actually have had eligibility at different rates than we have, but I do think it's important to not lose sight of the forest for the trees. I just want to share some information that really, I think, justifies our decision-making here. Earlier this month, a nonprofit health data organization called Sergo Ventures and Associated Press analyzed states that made people eligible earlier and found all sorts of factors from those decisions actually stymied the performance of their vaccine strategy. Obviously, just increasing eligibility is not enough. You actually have to have people get the vaccine. That research shows that a more methodical, priority-based strategy, ones like what we have done in Washington, could be a more effective strategy than simply just having everyone fight each other to the gates on day one. In fact, 7 of the 10 states that have done the worst in their vaccination performance right now had larger than average shares of their residents remain eligible. Or were eligible. So basically, this research, I think, backed up the priority-based decisions that we have followed to date. Now, we're in a good position to make everyone eligible because of the way we prioritized people in our process. We followed science, which is we began with the most vulnerable, older adults, for those who represent 90% of the fatalities in our state. Folks in long-term care facilities, folks who've had disabilities, and now folks who have comorbidities. We've expanded it to other congregate settings like farm worker housing, jobs that have higher exposure risk, like working in a grocery store or now a restaurant. And we've absolutely remained focused on equity. We still need to make progress in that regard. That's why we're so committed to taking care of our agricultural community. It's one of the reasons I'm thrilled that we are opening with the federal government a mass vaccination site in Yakima. We're now 4 out of 5 or 3 out of 4 of our big max vac sites will be in Eastern Washington to help with this community. So we have more work to do in that regard. So we still have work to do in our vaccination. Now, I'd like to take a moment about an emerging concern that we have in our state. Obviously, we have concern with the uptick of the cases that we are now experiencing. But we are becoming aware of a group of Washingtonians that are really in a very exposed position, and that is the 28% of people over the age of 65 who still have not received their vaccine. We are very concerned about this. Now, these are folks who've had now 3 full months to obtain the vaccine, but still have not been interested in getting the vaccine. This is really disturbing to us because we know this vaccine is extremely successful. This remains a fatal disease, and as I've said, we've had an uptick of cases, meaning these are folks who are more exposed than they were a few weeks ago to this virus. And so basically we have tens of thousands of people, those over 65, who have not had the vaccine, who are really living in the danger zone right now. It is a dangerous situation not to be vaccinated, particularly if you're over 65 today. And we want to do all we can to protect these folks who are today in the danger zone. So I'm calling on all of us to help these folks, our parents, our uncles, our aunts, our grandparents. I'm really hopeful that everyone can have a discussion with the people they love who are of a certain age and urge them to get this vaccine. That's one of the most important discussions you can ever have with your parent or your grandparent or your uncle, your aunt, or your neighbor, which is to get them to help save their lives. I just can't stand the thought that in the next 2 months we'll be losing folks that we could save with a simple vaccination. And all of us, obviously, government can help by making the vaccine available as we are today. But we got to have people who are willing to get it. So I really hope that people can encourage folks. it would be a wonderful family outing to go to a place with your grandparent to get the vaccine. Because this saves everybody, doesn't matter where they are, urban or rural, doesn't matter what party you're in, this can save your life. So I hope people help these folks who today are in the danger zone. And I want to reiterate, these folks will remain eligible for the vaccine as long as we have it. So just because you haven't, if you're 70 and you haven't had your vaccine yet, just because we're opening up the vaccine eligibility to more people doesn't mean you can't still get it. So we really, really hope people will help save themselves and their loved ones. With that, I'm going to turn to some comments to Dr. Amer Shah. Doctor.
Can you hear me?
Yes.
Great. Well, thank you again for providing the leadership in where we are as a state. And I just want to recognize all the different moving pieces that are part of what you announced today. But first of all, I agree with you. We're making a lot of progress in vaccines. As we know that we had previously, way early, 2-3 months ago, had set a goal for 12,000, 13,000 vaccines on a daily basis. And we started at that, and we set a goal for 45,000 vaccines a day. And now we've exceeded that. We're at 54,000 doses per day. And that is just a testament to all of our partners on the ground and all the efforts in local communities. We have now to date given 3,245,982 vaccine doses. And I know the moment I said that, it's actually now inaccurate because we are every day having more and more people getting a vaccine dose. And the good news is that 1.2 million people have been fully vaccinated, which is more than 16% of our population, and more than 2 million people have received at least one dose, which is more than a quarter, 27% actually of our population. But the governor is right that over the age of 65, while almost 73% have at least received one dose and just over half have been fully vaccinated, we still have seniors who have not received a dose of vaccine and seniors who are not fully vaccinated. And we want to make sure we do everything we can to get seniors especially to get vaccinated. So I would urge all of you to help us, as the governor said, get the word out to community members, neighbors, friends, family, grandparents, aunts, uncles, whomever you work with who are above certain age, especially 60 or above. We want to make sure that those individuals get vaccinated. We also have a COVID-19 hotline, which is scheduled over 25,000 appointments. And I think this is really important that as we continue to talk about the fact that it's important to have online access and the ability for people to get be able to make appointments online. We know with seniors, oftentimes that's not possible. And so what we have put in place are a number of efforts, and one of those is a COVID assistance hotline, and the number is 1-800-525-0127. That's 1-800-525-0127. We also have an alternate number, which is 1-888-856-5816. It is not just a hotline in English. It actually includes multiple languages, including Spanish. And I just want to make sure people avail themselves of that hotline. If you don't know how to get vaccine, please do work on getting that phone number to people. Again, 1-800-525-0127. And our focus is not just on numbers, it's on equity, as the governor mentioned. And he's already highlighted many of the efforts that are happening throughout the state of Washington, whether it's in rural communities, smaller jurisdictions, or large communities, urban jurisdictions. And we want to make sure everybody recognizes the absolute critical importance of equity. It's no matter who you are, where you live, where you come from, we want to make sure that you are having access to COVID-19 vaccine. And I also want to thank you, Governor, because you mentioned the opening up the eligibility on April 15th, and you also talked about the 4 months that we've spent in protecting people most at risk, which is what we've been doing for the last 4 months, and that's why we've been very methodical and careful on who we open up with and the eligibility criteria throughout. And I think what the other thing that Governor did not mention, but I'm going to underscore because I know he believes it, it's not just the 4 months of where we've been, it's the 4 months of where we're going. It's really what's the road ahead. And the road ahead is that we've got a lot of work to do still with vaccine efforts. We've made tremendous progress, but I also think that we have to realize that this pandemic is not over until it is over. And when you look at what we have done in Washington, and Governor mentioned this, but let me just underscore this. You look at COVID-19 death rates in other states or across the country, our collective efforts in Washington during this pandemic have saved an estimated 7,000 to 15,000 lives. And that's 7,000 to 15,000 Washingtonians that are still with us. And that is just a testament to everybody working together. So while we are pleased and excited that we can open to everyone above the age of 16 on April 15th, we also recognize that we have vaccine supply that continues to be a challenge for all of us. And that vaccine supply is going to be something that we are continuing to work with the federal administration on. And the governor has done a lot and his team to get more vaccine into the state of Washington. But again, it's a three-legged stool of supply, it's logistics, and it's demand. And that demand really, again, includes our seniors. We want to do everything we can to make sure that our seniors get vaccinated. As we continue along this road, we're going to be in a much better place in the summer and early fall. So the next 4 months are actually a markedly better place if we continue not to let our guard down. But we are concerned by the trends that the governor mentioned, the surge that we were coming off of that has started to flatten, that started to plateau, that we're starting to see an uptick. That is concerning to all of us in the health community, whether healthcare delivery, or public health. And it's not just a Washington phenomenon. This is happening across the country. So spring break, holidays that are coming up, there are many different things that are happening, and we want to make sure that people are protecting themselves and doing all the right things. And, we've seen images of people in other states that have, not been with masks and not doing the things, and we don't want that to be a Washington phenomenon. And with the holidays of Passover, Easter, Ramadan that are coming up, I just want to remind everybody to be emotionally together yet physically apart. We've got to do everything we can to continue to fight this pandemic together. The other thing, Governor, and I know you're going to take an exception to this, so I apologize in advance for saying it. But I still have a little bit of Houston blood in me, and University of Houston is in the Final Four along with Gonzaga, as you know. And I do want to just make mention that while I will not tell you who I want to win the full tournament, I'll be very careful. But what I will say is that regardless of who wins or what happens, we want to make sure everybody celebrates. Let's hope a Zag win, but to celebrate safely. This is not a time for us to have March Madness parties and not wearing our masks or being in congregate settings or in places where all of a sudden you forget that we're still in the pandemic. Absolutely, if you're sick, stay home. If you've been exposed, get tested. We want to make sure everybody's doing all the right things. But the most important thing, the critical thing, is that we are concerned that we are seeing trends that are not going in the best direction. And that means that it's going to be up to all of us. And again, let me just close by saying we're in this pandemic until we're out of the pandemic. And that means that we need to continue to do everything we can to vaccinate people, make sure our seniors get vaccinated, but certainly avoid all those instances that are going to potentially put people at risk. And with that, Governor, I'll turn it back to you. Thank you.
Thank you, Doctor. I'm sure you will try to minister to the Houston fans in their sorrow at their forthcoming defeat. Just a couple comments. Look, and we're asking folks to remain committed to this, but I just want to give you two factoids about why we think this makes sense. I want to put up a chart that shows our number of daily cases relative to other states. And if Josie can tell me when that's up. Basically, this shows several states and what their infection rates are most recently in the last week. At the top, we show Michigan, then New York, then Minnesota, then Florida, then the average for the United States of America, and then you see Washington quite well down the list. The reason I'm showing this to you is to give you everybody confidence of what we're doing is working so that we can remain continuing committed to what we're doing here because it works. We know we can keep these numbers down relatively well at least compared to other states that have had difficulties. And we now are in the top third in the efficiency of our vaccination program in the states as far as the percentage of doses we're getting in arms. So we are having success. We hope people will continue to be on this effort. Switching gears a little bit, I just want to talk about a meeting I had in Anacortes yesterday, which was a meeting about the tremendous 2 bills we have in the legislature to fight climate change. COVID's not our only challenge. COVID and climate change have some similarities. They're both existential crises, and both can be defeated with science and confidence. And we have 2 bills in the legislature that now will give us the opportunity to defeat climate change and grow jobs. That bill was involving our Clean Fuel Standard, House Bill 1091, and our Climate Commitment Act, Senate Bill 5126. These bills both will effectively restrain carbon pollution that is causing climate change and ocean acidification, and both of them have the ability to grow our economies. I was very appreciative of Matthew Hepner, a leader in the International Brotherhood of Electrical Workers, who talked about the ability to grow jobs by creating biofuels industries and putting people to work. This is a union leader with the IBEW. Michelle Simmons, also from Silfab. Silfab is one of the most rapidly growing solar panel manufacturers. They're now opening a new plant in Burlington to hire just under 100 workers. She talked about the ability to put people to work in the clean energy industries. And Steve Edwards, chair of the Swinomish tribe, who talked about the necessity of saving our salmon. We now have 2 bills in the legislature that could make such a huge difference in our march for clean energy. And we're hopeful that the legislature will continue progress on both of those bills. Now, this is very heartening because the Biden administration unveiled the first part of their infrastructure and clean energy plans that we believe can create millions of jobs, help defeat climate change, and recover our economy. It did so in an appropriate, ambitious, and realistic way. I couldn't be more thrilled of what the president is proposing. We know that the investment in new technologies and jobs can work, and what he's proposing is very much consistent with what we're doing here in the state of Washington. He knows, we know, Washington knows that transitioning to a clean energy economy creates jobs up and down the scale ladder. And we know our success of investment in zero emission vehicles, clean buildings, and the greenest transportation package we had last year, and I hope we can pass another one this year, is a model for what the nation can do. So we have both the federal government and the state of Washington arm in arm creating jobs and fighting climate change, and that's a great day for all of us. Yesterday, I want to comment on a historic day. Yesterday was the 79th anniversary of the day the United States government ordered persons of Japanese ancestry to go to camps, including on Bainbridge Island. We need to learn from that. We need to learn to stand up against xenophobia and racial animosity. We've seen this on the sidewalks of the United States and unfortunately in our state. And we need to stand up against this violence against the API community. I did so with leaders of that community in Renton last week. And we ask everyone to stand up against this violence. I wanted to alert people of a way you can do that. A state-based grassroots organization called Stop the Hate has resources for the victims of such threatening behavior. They're at stopthehate.community, stopthehate.community. State government also has resources to support victims of crime involving these kind of activities at the Crime Victim Service Center. They're at 1-888-288-9221 or online at our Washington CVC hotline. That number's on your screen. Our Labor and Industries in the state also has Crime Victims Compensation Program, and that website and phone number is up on your screen as well. Don't be silent about this. We have to stand up together against this outrageous behavior. I want to mention the 4th round Working Washington grants for small businesses are now open. I talked to one yesterday that hopes to avail themselves of that, of a wonderful outfit in Skagit County. And those grants can be awarded up to $25,000. Those are available at www.commercegrants.com, and I encourage people to be involved in that. Last but not least, today is Cesar Chavez Day. I signed legislation declaring that today in recognition of his leadership. And we need to continue in his spirit. I think of Tomas Villanueva of Yakima Valley, and his spirit needs to infuse our vaccine efforts to make sure we get agricultural workers this vaccine. And we need to dedicate ourselves to that, and we are. So with that, happy to stand for questions.
First, we'll go to Rachel LaCourte with AP. Go ahead, Rachel.
Hi, good afternoon. For either you, Governor, or Dr. Shaw, for those who are currently eligible, there's been increasing difficulty to get vaccine appointments in urban areas compared to rural areas. And that's not just here in Washington. We're seeing that in other states. Considering that not everyone can take a day off of work and drive to areas where there's more supply, is the state considering increasing or diverting supply to counties that are seeing the highest demand by April 15th?
First off, there's a lot of misconception about that. There really are no wasted doses in the state of Washington. In some of the rural areas of our state, they have made sure that all of these doses are getting to arms, and they are. So I can give you a high level of confidence that there sometimes are longer waiting lists in one county than another, or city than another. But in all of those cities and communities, doses are getting into arms. And that's fundamentally what is important. We have an absolute infinitesimal level of wasted doses in our state. And so that's very important. We've been extremely sensitive to this so we don't waste doses. That's where we start with. We also want to applaud the local leaders have found a way to make that the situation. Now, we have found some differential in interest in the vaccine. Some of our rural areas, some of the communities have had less interested, but we nonetheless have found, even that's the case, doses are getting into arms. So, Dr. Shaw, do you want to answer more directly Rachel's question?
Dr. Shaw, we can't quite hear you.
Can you hear me now?
Yes.
Okay, perfect. Sorry about that. I had multiple mutes on at the same time. Yeah, Governor is correct. We are constantly looking at what's happening throughout the state of Washington, whether it's urban areas, rural areas, whether it's larger jurisdictions or smaller jurisdictions. And where we think that any adjustments need to be made, we're certainly working with the local health jurisdictions. But right now, we still see enough demand throughout. And obviously now there's an additional group of people that are eligible. And with today's announcement, with another group of people, will be everyone essentially above the age of 16 eligible starting in a couple of weeks. We do see that there is enough demand across the system. But again, we continue to monitor. One thing that I did want to mention is that Vaccine Locator is now on our website. We phased out the Face Finder, so we phased out Face Finder, and Vaccine Locator is really a one-stop shop where you can actually go to it and click on, and it gives you where in your area you can get vaccines. And we want to make sure that you do everything you can to get that information out if you can to others, especially, like I said, including that phone number to our seniors. I've made a particular push about seniors as the governor. We really want to emphasize that we want to do everything we can to make sure that seniors are not just staying behind or waiting. This is the time for seniors to really get vaccinated.
Yeah, and there are some disparities in the percentage of seniors from county to county being vaccinated. We do want to make sure that they continue to have the ability to get a vaccine. There are currently 333,481 Washingtonians in that danger zone. These are people over the age of 65 who have had neither one of their vaccines. Over 330,000 people who are exposed to losing their lives in the next several months if they don't get vaccines. And so we want to maintain the ability of them to get the vaccine throughout the state of Washington.
All right, up next, we'll go to Joe O'Sullivan with the Seattle Times. Go ahead, Joe.
Yes, 3 quick questions for the governor or the secretary, whoever can answer. People becoming eligible on April 15th, can they go on line and make an appointment starting today? Number two, Johnson & Johnson reported lost 15 million doses due to an ingredient mix-up. Will that impede our efforts? And number three, is this announcement based off an increasing amount beyond what you'd recently expected in shipments from the federal government for vaccines?
Well, let me answer the last one. It's in part on increasing allotments. We've gone, I think our allotment increased tens of thousands this week. So it's partly because of our increasing allotments, but also it's because we've been going through these tiers with efficiency and rapidity, and that's allowed to move these transitions faster and still get people who are in the danger zone actually vaccinated. The J&J situation at the moment does not appear to change, well, it isn't our decision to open it up on April 15th. And your first question was, I'm trying to remember here, what was your first question?
People making appointments. Can they make appointments today if they're eligible April 15th?
Dr. Shaw, you want to talk that?
Yeah, what we've thus far been doing is we don't open up the eligibility until the actual date, because we're still trying to make sure that we can get folks that are eligible for vaccine currently that are able to get the vaccine. So right now we don't have that capability of doing that, but that is something obviously we can continue to look at. But right now it is not. So right now it's really the people that are eligible today over the next couple of weeks that can get vaccine. Now that said, Michelle, there was something we were looking at with that. Michelle, did you want to say anything about that?
Yeah. If there is appointments online for after April 15th, people could start scheduling them, but they roll out. Most providers will not be listing their making appointments available that far out. So it would depend. You could look on the vaccine locator, but really the appointments mostly are there probably are for the next week or so.
But if you are, if you are really anxious to get your appointment, but you got to wait a couple weeks, I hope you'll think about calling anybody you know over the age of 60 that you love and ask them if they've been vaccinated. And if they say no, say, look, this should not be an ideological issue. We love you. We want to keep you around for your next birthday. And you can go down and make an appointment today. They don't have to wait. So we hope people will consider doing that while you're waiting.
All right, up next, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
Questions here. Do you expect this April 15th opening of eligibility to coincide with any expansion of sort of vaccine infrastructure or other changes that might open up more appointments? And then a follow-up on Rachel's question, are you seeing a lot of people drive from the Puget Sound area to other parts of the state to get vaccines? And if so, how do you plan to address that?
So, Governor, I'll take that. Two things. One is that we're continually and constantly looking at ways that we can increase infrastructure. And as I mentioned, the three-legged stool of the supply, the logistics administration, and the demand. And those are the three aspects of what we continue to look at. And so, as you know, with the Yakima site that's opening this week as well today, that also is an example of increased infrastructure. We continually see additional allocations coming from the federal government into some of those additional streams, such as pharmacies and community health centers, et cetera. And then we're continually doing what we can with our local partners, given the supply constraints. But as we have the assurance from the federal government that over the next several weeks, and I would expect this is going to be into May, that we start to see increased supply, then that is when you really do have logistics and administration that's going to also be ready to receive that supply. And then certainly throughout this process, vaccine demand is something that we look at. Now, as far as people going from the Puget Sound area to the eastern side of Washington, or frankly from the eastern side of Washington coming over elsewhere to the western side, we are hearing some reports of that. We don't have a quantification of how much that is. Again, we want to make it easy for people to get vaccines close to where they are. And when supplies are just not there, then that is the real challenge. So we're hopeful that that's going to continue to be addressed as supplies increase.
Yeah, there is another thing, and that is the federal program. the federal government is fairly rapidly increasing their distribution of this vaccine. So you actually today have two channels of getting the vaccine, one through the state effort and one through the federal effort. And the White House in our discussion last week said that they are going to be rapidly increasing the federal program, including what they call the federal pharmacy program. These are where the federal government gives to pharmacies in the state of Washington directly doses instead of going through the state of Washington. They tell us that something like 90% of Americans will live within 5 miles of one of those pharmacies. That sounds ambitious to me, but it's nonetheless what the White House has shared with us. So this is an increasingly accessible program as well across our state, thanks to the federal distribution channel. Now, in addition to that, the federal government is also distributing through the Veterans Administration Service and through the Department of Defense and a variety of other channels. So that's why we're confident in our ability to open up our state.
All right, up next, we'll go to Laurel Demkovich with the Spokesman Review. Go ahead, Laurel.
Hi, Governor. This is kind of a follow-up to the first answer that you had. We are seeing a lot of open appointments in Eastern Washington. And so I'm wondering how much that kind of affected the decision to open it up to everyone, and what exactly is being done from the state or from local jurisdictions to address some of the vaccine hesitancy that a lot of those smaller communities are seeing.
Well, we're doing everything we can about hesitancy. Obviously, I've just talked about it for quite a while today, but we have a extensive advertising campaign to encourage people towards the vaccine in 32 different languages on multiple media outlets to encourage them. The federal government has a similar effort, and you'll be seeing a lot more of federally financed media about this that basically says we can do this, and we can do this if we're all pitch in. So there will be a much more visible media campaign in the English language as well, shortly through the federal efforts as well as our own. Now, I want to reiterate, the solution here is as much of our individual efforts as it is any government. Look, the thing that's more powerful than any governor or president is a grandson or a nephew or a spouse. That's the most powerful thing to really get people to save themselves. And that's why the best thing we can do is encourage individual help on this, to help with your loved ones. And that's what we're encouraging people today. As far as the disparity between counties, that really did not drive our decision here. What drove our decision is the recognition that we have increasing supplies and we're moving through these phases faster than we might have otherwise anticipated. And that's really good news. It's based on part on our efficiency. I indicated we're in the top third on efficiency. And you know, I've just talked about the lives we've saved. So it's based mostly on those two facts.
Governor, if I could just add one other thing to what you said in terms of nephews and nieces and family members, and I completely agree. The other important component is the physician, the doctor. And you and I had that conversation just yesterday that there are some reports out there that are showing that when a doctor or a physician says, I recommend this vaccine, or I recommend you getting the vaccine. And by the way, the vast majority of doctors around the country, I think it's about 90%, if not over, have received the vaccine themselves. That is an incredibly important statement to their patients, their individuals that they serve. And so we're going to continue to also work with, and we've had some great partnerships with our healthcare community and the various associations to continue to let them help us and for us to help them get the word out to their patients and their individuals in their community as well.
Yeah, let me just add to this. Look, as a governor, I would like every physician, every chiropractor, every dentist, every physical therapist, I would ask you to consider communicating to all the patients that you treat and share information with them. That could be a real lifesaver because they trust you, and that information we need. Again, we have 330,000 people today that have not protected themselves. This is like people driving around without seatbelts or worse. So I hope the medical community can use their persuasive ability with their patients. Hospitals as well. I hope the hospitals will communicate with everybody they've treated in the last 5 years. They have their phone numbers and emails. Send them an email. We hope that they'll do that.
Great. Up next, we'll go to Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Thank you. Governor, the eligibility is opening up. You mentioned the targeted the mass vaccination sites, and the federal effort is targeting areas like the agricultural workers. I'm wondering, in light of a lawsuit that was filed Monday by inmates, is your office considering developing a targeted vaccination of inmates and correction staff workers? And could you also respond to some of the issues raised by that lawsuit in which inmates do not want contact with unvaccinated staff people?
Well, we are vaccinating incarcerated individuals. There are doses being delivered as we speak to the Department of Corrections, and that is moving apace. So our incarcerated individuals have been treated with the same level of availability as the non-incarcerated individuals. Many of them have already been incarcerated because they've been eligible under the same eligibility criteria, particularly those over the age of 65. So yes, we are moving forward. All of those incarcerated individuals that are living in congregate facilities are now eligible. They will be vaccinated.
All right. Up next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Good afternoon, Governor. I'm wondering if you've got more than 30,000 people, I think that you said, that were eligible who chose not to get vaccinated. Is there concern, or do we have any idea of what that number might be with this younger crowd that's about to become eligible on April 15th? And then wondering if you could give me an answer. I've heard from people who say if we have to wear masks, social distance, not travel, and do all of these things we've been doing, what's the point of getting vaccinated?
Yeah, it's actually 333,000 folks over the age of 65 who have not received either dose yet. And those are the folks we consider mostly in the danger zone. Again, these are the folks, this is a very unusual virus. 90% of the people it kills are over the age of 60, 90%. And so it's a very specific group of people who are so endangered by this. And that's why these 333,000 people are the ones we really need to talk to immediately, that I hope people will do so. Look, the reason to get the reason to wear your mask and the reason to get a vaccination is several-fold. One, if you don't care about anybody in life, if you don't care about your parents and you don't care about your grandparents and you don't care about your neighbors, and the only thing in life is your own skin, there's still a reason to get this vaccine. It can save your life. We still have young people who have lost their lives because of this vaccine. We still have young people who have the long haul syndrome that have had quite profound long-term consequences at early ages of, exhaustion and some mental difficulties and not having a sense of taste and the like. So there is a reason, just like you get medicine for anything else, for young people or anybody to get this vaccine, even if you don't care about anybody else. But I would hope that people would feel some degree of kinship and affection for the rest of humanity. And we're asking for everybody to get the vaccine. If there's anybody you love in your life, get the vaccine for them. A girlfriend, boyfriend, neighbor, relative. If there's anybody you love, please get the vaccine, because it's an expression of love for them so you don't infect them. So I think these are pretty powerful reasons to get the vaccine that I would articulate. Now, as far as the mask and everything else, these are just common sense things. We've been doing it. It works. We just need to keep doing it for a certain period of time. We know they still work. And there are places where that has not happened. We have some college campuses right now where we have great outbreaks because we've had irresponsible behavior, and that's endangering the whole community. And so we need to ask for more responsibility for some of our college students as well.
Go ahead, Keith.
Governor, how much patience are people going to have? You talked about you moved up the eligibility, but you can't control the vaccine supply. How many weeks or months is it going to take before the supply is keeping up with demand?
I'm going to ask Dr. Shaw. I'm not sure I can give you a real projection. I can tell you that my sense is, first off, there will be frustration until we get to the last dose administered, but my sense is that the doses will grow fast enough that it won't get worse as far as the frustration level. I can't say it's going to get better. Dr. Shaw, do you want to have any whack at that?
Yeah, Governor. So, you know, we are, this week we saw an increase in doses, over 400,000 total doses with Pfizer, Moderna, and Johnson & Johnson. And over the next couple of weeks, we do not have the J&J vaccine, but we have Pfizer and Moderna, and it's somewhere in that 345,000 April 4th week, and April 11th week, 368,000. So that's just a lot of numbers. That's not really what people want to hear. What people want to hear is where and when can they get vaccinated. And the good news is the supply continues to increase, as I mentioned, outside of this one blip where it looks like the J&J vaccine, including with some of the continued work that needs to be done on the allocation and getting the vaccines, all three of those vaccines, to states. The bottom line is that it is going to require some patience. Just because we've opened up on April 15th, eligibility for those above 16 doesn't mean that you snap your finger and on April 15th you'll be able to get the vaccine. Some people will, but the vast majority of people will not be able to on that day because we don't have enough supply. But what we also don't want to see is that as the supply increases steadily and then all of a sudden it really increases, and again, I'm anticipating that'll be likely in the May timeframe, that what we don't want to have happen is that we are now trying to catch up on the eligibility side. So I think the move today is really, it really is, again, as the governor mentioned, we've had 4 months where we've been doing everything we can to get the word out to everyone and do everything we can to vaccinate those who are most at risk for an adverse outcome, a negative outcome, a bad outcome from COVID-19. And while with seniors, for example, and others, we want to continue to prioritize those individuals, we now do know that supply is going to be increasing. And this allows us to now focus not just on those groups, but really focus on where we need to potentially thread the needle and really accentuate our focus where we may have gaps in where people are getting vaccination, whether it's by age group, whether it's by occupation, whether it's by geography, whether it's by race, ethnicity. We want to make sure we're doing everything we can from an equity focus. So I think it's really, at the end of the day, just the fact that supplies will continue to increase, and we want to be and continue to be ahead of all that as the supply increases.
All right, we've got time for just one more question. We'll go to Charles Featherstone with the Columbia Basin Herald. Go ahead, Charles.
Good afternoon, Governor.
Hello.
So the state of emergency, when's it going to end?
I can't tell you. I mean, it's not. I would tell you if I knew, but we just don't have enough crystal ball to be able to answer that question. What we do know is we're making great progress in this fight against this COVID. What we do know is we have the tools to fight, and if we all use those tools, we're going to save a lot of lives. That is what I know today.
Any closing remarks?
No. We're saving thousands of lives. We've got a vaccine that works like crazy. And I hope people in the next few days and weeks will focus on the people they love and themselves. It'd be a good day to talk to somebody in the danger zone, and as we are expanding this eligibility, to ask them to take advantage of this. That's a great day. It's a sunny day. It's a good day to save lives. We can do this. Thanks a lot.